Hi, Kelsey. How you doing?
Good, Josie. How about you?
Good. I have one of yours. Room
Good.
307.
Okay, great. So we'll go into the room and do a little bedside report. So, patient.
Sounds good.
Okay, so this is Kelly Smith. She came in last night about 8 o'clock, 29-year-old female. She came in after a spontaneous rupture. She has a history of diabetes, preeclampsia. She had one previous placenta, a placenta previa with her first pregnancy. She is a 32002 for her GPAL. As of now, she's still in her first stage of labor. She was 4 centimeters dilated, and the last time I checked was half hour ago. We started Pitocin to help kind of induce her a little more quickly. She nothing for pain. She kind of wants to do it naturally, right?
Mm-hmm. Yeah.
Okay.
All
So
natural.
all natural. Nothing for that's her birthing plan. She wants to stay off the pain meds. Vitals go. She's been stable all night. Her last set of vitals were 120 over 90, heart rate of 80. Afebrile, last temp was 98.9. Heart rate or respirations were 18. O2 has been high 90s. Last was 98, and she rates her pain a 5 out of 10. Assessment wise, she's alert and oriented times 3. Sorry, alert and oriented times 4. Lungs sound good. Cardiac wise, she's got an S4. What is that?
Dear. It's just S1, S2.
S1, S2.
It's like normal. It's normal.
Okay. I'm going to start that again. Okay. Assessment wise, she is good. She's alert and oriented times 4. She's on room air. Lung sounds are clear. Cardiac is normal. She's been sinus rhythm all night. Yeah, no edema. Skin looks good. She's been up and walking the halls. Her fetal heart rate, the baby has had some early accelerations. Baseline, he's been at 120 though, so we're doing okay there. Yeah, hopefully in the next few hours we'll be having that baby and things will be good. So,
Awesome.
do you have any questions?
Yeah. Does she have any support at all or visitors coming?
I believe you have a husband.
My husband should be coming soon.
Okay.
Yes.
Yeah.
He's going. Yep, he's coming back.
Okay.
So he's
Awesome.
coming back. He did come in with her, but had to go take care of some stuff at work. So he's hoping that he'll be back soon, in the next couple hours, hopefully. So, yeah.
Okay. Awesome.
Oh yeah, Ivy. She's got a 22 gauge in the right arm or in the right hand, and that has that. Yeah. Pitocin running. Good. Yep, right here.
Yep, don't show me.
Oh, okay. All right. Do you have any questions?
I think I'm good. Thanks, Kels.
Right. Well, I will. Kelly, Josie's going to be your nurse. If you need anything from her, you just let her know, okay?
Hi, Kelly.
Just going to get your blood pressure here.
The pain is getting worse, but it's okay. It's expected, you know. I'm trying to
Yeah.
do this control.
Can I see your arm there for me? Oh, thank you. Just going to assess here. Perfect. Everything's looking good. Can I have you look at me here? Okay, perfect. Now I'm going to just shine this in your eye. Sorry. Can you follow this pin in? Perfect. And just follow the pin with your eyes. Don't move your head. Okay. Perfect. I'm gonna assess your pulses down here and just see if we have any edema. I have a little, but nothing +1, which is, you know. Feel your pulses down here. Can you take your feet and press them against my hands? Awesome. Now I'm gonna do okay, perfect. Okay, I'm just gonna feel some stuff down here. Okay. Do you mind if I touch your face real fast? Just a quick little.
Okay. You can touch my face.
Awesome. I'm just gonna look here at your stomach too, you know. Assess the bowel sounds. We're gonna feel where your fetus is. The fundus. Okay, I got your pulse ox on here. Perfect. Do you have any concerns, any pain or anything? I think I already asked you that.
No, I just, it's been kind of a long process. I just want to have this baby.
Yeah. Well, you're getting there. Your contractions are, speeding up slowly, but well, I'm gonna go. Your call light's in reach. I'm gonna just go check on a few other patients, and I'll be back. Just remember, my name's Josie. And I'm gonna be your nurse today. So, do you have any concerns or anything before I leave?
Not right now, but thank you. I'll let you know if I do.
Okay, sounds good. Pushed your cold light. How you doing?
Yeah, I'm having really hard time breathing, and I don't know why.
Yeah. Okay,
Yeah.
let's turn to the side here. I'm gonna raise your head to 30 degrees just so we don't tilt your uterus. Your baby's in the NICU. She's doing good.
Okay.
Did that help at all?
Not really. I still can't breathe.
Oh my, okay, your sats are at 85%, so I'm gonna get some oxygen on you here. We're gonna set it to 8 liters. Does that help at all?
Kind of, but I still feel like there's just like something in my lungs. I can't breathe.
Okay, I'm gonna call the provider real fast.
Okay.
I'm also gonna get an IV ready. So I just called your provider. He's on his way. So I'm initiating an IV catheter here. I'm having a nurse going to get some blood, and we're starting some fluids for you. How are you? Is there anything I can do? I just want you to breathe in and breathe out, and we're doing whatever we can to take care of you, okay? Okay. So our doc's coming. I'm gonna also just get some intubation equipment ready if need be. Don't worry though, we're doing everything we can to take best care of you. Is breathing a little better?
Kind of. Still hard.
Okay. So I'm also gonna insert a urinary catheter for you right here. The blood's here, so we're gonna do our kind of batability check, and we're also gonna start getting that infused, okay?
Also, there's just like, so I feel like I'm bleeding, and there's like bleeding at my IV site.
Oh, yeah. You have some blood on your lips too. I'm a little concerned this might be an amniotic fluid embolism. The provider's here. Okay, he's gonna take a better look at you here. We're getting that blood and those fluid going. We're gonna amp up your oxygen to 10 liters a minute. Are you feeling any better?
I feel very lightheaded, and yeah, I don't know. I just like breathing is still like hard.
Yeah, we got some blood going, so hopefully that will help with your bleeding here. And the doc's here. We're gonna see what we're gonna do here, but your oxygen should be helping you breathe a little better.
Okay.
Hi Kelly, this is Josie. I just came to check on you. How are you doing?
I'm okay. I kind of dizzy a little bit still. A little nauseated. Is my baby okay?
Yes, I was just in the NICU checking on her. Vitals look great. She's just so beautiful. So things look good.
I wanna see her, but what happened? I just got super dizzy and I felt like I couldn't breathe, and I've never experienced that in any of my previous births. And I don't. Yeah, can you explain that to me?
Yeah. So what happened is you had amniotic fluid embolism. And what happened basically is, so in your amniotic fluid, your fetus antigens kind of mixed, and this caused basically imitating an anaphylactic reaction. And so you had excessive histamine mediators released, and so this can kind of cause that like septic shock, so why you couldn't breathe and you felt hypoxic. And it has a lot of side effects with that. It can cause disseminated intervascular coagulation, so that's where that bleeding from your IV site came, and bleeding under your lips. And it also can cause that urine atony, and luckily we didn't see much bleeding in your uterus, but that's something we're going to assess for. So yeah, it's more of a rare one, but your vitals are looking good right now. Do you have any questions about it?
Is there any like long term effects for me? Should I be concerned, or like why did this happen? It didn't happen in my other births. Like, is there any like risk factors or
Yeah. So the risk factors, advanced age, your placenta previa definitely could have played a factor in that. Preeclampsia, you had a history of that. Diabetes. If you had did you have a C-section? I can't remember before. No.
no?
Okay,
I
that
haven't,
can.
but I do have diabetes, and I had
Okay.
preeclampsia in my previous births. So I guess like yeah, I guess I kind of lined up for risk
Yeah.
factors for.
Yeah. Labor induction, you were on Percosin, and so that could have played a factor in it too. So.
Oh, for the introduction. Yeah, I guess yeah, that's odd, but I guess and is that you said that was rare?
Um, it is one of the more rare. It happens though. Labor is just a complicated, you know,
Yeah.
so.
Should I be like worried about any prolonged long-term consequences of it?
I don't think so. I mean, it is something to consider for future pregnancies. That could be more of a high risk pregnancy. So that is something that you and your husband should think about. But
Okay.
yeah, we'll probably just keep assessing you, and having more follow-ups, so just postpartum is also we'll do some postpartum depression screenings and just keep monitoring you. So.
So should I like bleeding is something that we're gonna be monitoring for a little
Hmm.
while to make sure it. Okay.
Yeah. Yeah.
Okay.
Yeah. Is there anything else I can explain to you, Kelly, or?
I don't think so. Yeah, I guess I just want to see my baby.
Yeah.
But
Yep. Well, I think in a little bit we'll be able to set up some um, way for you to interact with her. We just want to get both of you stable and make sure it's best for both of you.
that makes sense. Thank
Yes.
you.
Yeah. Yeah. Well, I'm gonna leave your call light here. These IC nurses will be checking on you, but I'll come back in a little bit just to update you about your little guy.
Thank you. I appreciate
Okay.
that.